Good morning, everyone. I'm Kristin O'Malley, President and CEO of the Cape Cod Foundation, and I'm very pleased to welcome you all here today to our second virtual community forum. I hope you had a chance to review some of the housekeeping notes that are displayed here on the PowerPoint. I'll also note that the session today is being recorded, and you should have seen a little pop-up disclaimer about that. Because of the number of the people on the call, we're asking that you remain muted and please use the chat box to make comments and ask questions. We will save time at the end for open Q&A with our panelists, and they've also offered to answer any questions that we don't address during the forum after the fact, so we'll be sending those out as well. We'd like to extend a big thank you to our sponsor for today's session, Polhemus, Savory, and De Silva of East Harwich. The integrated architectural design and construction firm is committed to supporting the local community and maintains the PSD Fund for Working Families at the Cape Cod Foundation. Over the past 11 years, the fund has distributed approximately $350,000 to support the Cape community. We're very fortunate to have PSD as a champion for Cape Cod and for the session today. So if you're not familiar with the Cape Cod Foundation, here are some quick facts. And if you are, you can take a minute and go grab another cup of coffee. We were founded as a charitable organization 32 years ago. We started with just one fund of $10,000, and we now manage assets of over $82 million through more than 320 individual funds. Since our inception, we've distributed more than $80 million in grants and scholarships back into the community. We have a staff of 9, 13-member board of directors, and over 100 volunteers, the majority of whom work with us on our grant and scholarship distribution. So with over 30 years of grant making and community expertise, it was really a natural fit for us to quickly establish a community emergency response fund last spring to raise and distribute funds to support Cape Cod during the pandemic. Since March of 2020, we've raised nearly $3 million and so far have awarded nearly $2 million in assistance to more than 50 local nonprofit organizations. It probably comes as no surprise that more than 70% of that support has been to help meet basic human needs such as food, housing, utilities, and healthcare. So for that reason, we chose to focus this first round of forums on basic needs, knowing that the issues are complex. And while we can't address everything, certainly in a 1-hour session, we hope that these offer an overview of the needs and some ways to get involved. We also hope that the series will continue, giving us the opportunity to dive deeper together and to focus more on solutions. So when it comes to housing, we're all likely aware of some of the pre-pandemic challenges we faced as a community. And unfortunately, those challenges have grown over the past year. Housing is intricately linked to every other aspect of life on Cape Cod and impacts a diverse range of local residents, likely more than any other issue. It's because of this that the solutions are so complex and our approach to problem solving needs to reflect that diversity and that complexity. We're very fortunate on the Cape to have a number of local organizations that are working to address these issues, and we're thrilled to have 3 of them here with us today. So I'd like to introduce Jay Coburn, who's the Chief Executive Officer of Community Development Partnership, Heidi Nelson, who's the Chief Executive Officer of Duffy Health Center, and Alisa Magnotta, who's the Chief Executive Officer for Housing Assistance Corporation. Thank you all for being here today. So I'd like to start by just asking each of you to give a brief overview of your organizations for a little context. So Jay, would you like to go first?
You bet. Thanks, Kristin, and thanks so much to the Foundation for this forum and also for your continued support of the work that we do at the Community Development Partnership. We are working to build a diverse year-round community of people who can afford to live, work, and thrive on the 8 towns of the Lower Cape. We're a nonprofit community development corporation, and we promote, develop, and manage affordable housing with over 100 rental units throughout the Lower Cape. We nurture the launch and growth of small businesses through training and technical assistance and micro lending. And then we collaborate and coordinate with business, nonprofit, and government partners to address the needs on the Lower Cape communities that will strengthen our year-round community.
Thank you very much. Heidi, would you like to go next?
Sure, thanks, Kristin. At Duffy Health Center, our mission in just a few words is to end homelessness through healthcare. So we provide a blend of primary medical care services, mental health and substance abuse counseling, and case management that wraps around those individuals that have the greatest challenges finding and keeping housing. Where our main site is located, you can see the picture there at 94 Main Street in Hyannis, but our service area includes all of Barnstable County. And last year we served around 3,000 patients.
Thank you. And Alisa.
I want to echo Jay's gratitude for you convening us, Kristin, and your team, because housing really is a community issue and requires us all to understand the issues and support, whether it's zoning changes or housing projects, in a community. And so having us all gather here is really a phenomenal thing to show the community support. And at Housing Assistance Corporation, we are really the regional one-stop agency for all housing programs. And from a high level perspective, we serve the entire region and the islands. And we, as you can see on the slide, we have programs that work with individuals who are literally homeless. We have family homeless shelters, but we also work on advocacy and housing development, and really think about the affordability gap for residents in the area, the lack of inventory and the need to actually build housing, and then a case management matrix where how do we make sure that the people who come into our agency have connection to the resources and access to other services, because we know that when they come in, it's not just housing. Right? There's usually a bunch of things going on, and how do we make sure that we have good partnerships and good programs in place to connect them with that broader foundation that's within the region.
Thank you. I know your organizations are all so complex in the work that you do, so asking you to give a 1 to 2 minute overview is really tough. So thank you for doing that. So let's dive into some questions. Alisa, can you talk a little bit about, you kind of started to do this a little with the primary demographics that your organization was serving pre-COVID, and then how you've seen the demographics of your clients shift, and also the numbers and sort of the need?
Because we have so many housing programs, serving people who are literally homeless to middle income families who are housed, and people who can't, pay their mortgage or pay their rent. We really serve low to middle income households is where we, put our demographics, if you will. And the thing about COVID is that it just really amplified the link between housing and healthcare and housing and our economy. So right, when the best advice from the healthcare professionals is to quarantine at home, that's the cure. You start to see really quickly that having shelter is a privilege, and we can see how precarious it is when someone was cash strapped before COVID, right, then lost their job, that housing instability and housing insecurity and the potential of becoming homelessness comes rapidly upon someone. So it's not that our demographics changed per se, it's that the affordability gap and the inventory, the availability of inventory in the region even became more compromised. And so, COVID put a spotlight on issues that were here before and just amplified it. So our numbers just increased exponentially. Our requests for services went up like 400%. To date, we've given out over $2 million in rental assistance. So it's the same problem that was there. It's just got bigger and more exacerbated. And COVID, like I said, allowed us to, have forums like this where it's really, in the forefront of all of our minds that this is a societal problem that has to be addressed.
Thank you. Jay, I'll ask you to go next. And I think you similar experience, right? Not necessarily a shift in demographics, magnification of the issues.
Yeah, very much. We focus our efforts on the 8 lower Cape towns, and similar to the Housing Assistance Corporation, support low to moderate income families in our community. And we serve about 500 families a year through our programs. But that, I think I would echo Alisa's observation that the demographics really have not shifted, but COVID has really just exacerbated underlying challenges that we face in the region. And I think one of the things that differentiates us a little bit is that we do both work on housing, but also support small businesses, because on the Lower Cape those issues are so intertwined. If we could have better paying jobs that were less seasonal, that would give people greater incomes to compete for housing. The lack of housing in our region is a real throttle on business growth and development, because people can't hire employees because their employees can't afford to live here. So that's why we work on both of those things. And I think, what we've seen is just that, the businesses in our community are fragile, and something like COVID completely underscores that. And then, I think the most fundamental thing for folks to understand about our housing challenge is that our housing market on Cape Cod, and especially the Lower Cape, has no relationship with our local economy and the jobs that people have here and the salaries that people earn. That the pressures of retirees and second homeowners with six-figure incomes coming across the bridge, that's what's driving our real estate market. And the fact that a homeowner can make so much more money renting an apartment on Airbnb on a seasonal basis. In fact, in Provincetown, that differential is $18,000 a year. You can make more than by putting your condo up on Airbnb for 120 days than you can by renting it out year round at a market rate rent. And so though COVID has only made those issues worse.
Thanks, Jay. And Heidi, I know, Duffy, again, hasn't seen the shift in the demographics, but you've certainly had to adapt to the changing needs of the clients that you serve. And, so can you talk a little bit about that and what you've done as an organization to shift your models and respond?
Sure, Kristin. So like you said, we haven't seen a major shift in the demographics of our patients. We're still serving the poorest of the poor on Cape Cod. About 2/3 of our patients have incomes that are below 100% of the federal poverty level. And if folks in the audience don't know what that means that these are individuals that earn less than $14,000 a year. Imagine trying to live on that. And a family of four living on less than $26,000 a year. Again, very, very low income. But you might be surprised to know something about the type of folks that we serve. Only about 15% of our patients are street and shelter homeless. So people that are staying at the St. Joseph's House shelter, or people who are unsheltered in our community. The vast majority of the people that we serve at Duffy are simply living with housing instability. So for example, boyfriend, girlfriend sharing an apartment, they're on a month-to-month lease, he's on the lease, she's not, especially if there are mental health or substance use disorder issues in the household, they're eligible for Duffy services. So something for the community to know is sort of the hidden nature of homelessness on the Cape. It's not like when you're walking around downtown Boston and it sort of hits you in the face. It really is much more of a hidden issue. Interestingly, we just did our annual report to the federal government, and in 2020, we actually saw fewer patients than we had in the prior year, but we provided more touches. So this is not unusual. Many medical practices saw a drop in volume because people were just reluctant to come into a doctor's office for the fear of COVID. So we saw about a 10% drop, but we had many, many more touches because of COVID. And I can swing into that right now, Kristin, if you want me to, or if you want to transition us there.
Yeah, no, sure. Go ahead.
Okay. So with COVID, the first thing that we did was we took a look at our finances. We had to look inside first and figure out how we were going to survive this. We looked at our finances and we estimated that over a 3-month period between April and June of last year, we could potentially have a big drop in volume and lose upwards of $600,000 over that short period of time. But we made the decision that we were not going to do any layoffs, we were not going to do any furloughs, and that was really worked to our advantage in the end because we were eligible for one of the PPP small business loans, and also relief did come eventually from the federal government. So once we knew we had our internal house in order, we were really able to pivot and look and see what was going on outside in our community. And there were two sort of major shifts to talk about. One was the shift of to see increases in the number of people who are unsheltered in our community. Of necessity, the shelters had to shut to new admissions. So there was no new folks being able, to go into the shelter. So they ended up on the street. And social distancing, they had to reduce the number of beds at the shelter. So those factors came together to increase the number of unsheltered, double what we had seen in prior summers. And so then the other thing that happened was that a lot of the programs that are there to meet emergency needs shut down. Feeding programs, access to public bathrooms, et cetera, et cetera, et cetera. So we jumped in, outreach. We worked with MEMA and brought a portable shower unit onto our parking lot with the support of Cape Cod Foundation, helping to support the incidentals that we needed to run that program. We offered bag breakfasts. We had meal ticket cards for people, working with a local restaurant in downtown Hyannis. So we were able to meet those immediate basic needs. We also set up a trailer, again, through funding from Cape Cod Foundation in our parking lot as winter came, because we had to limit the number of people who could come into the building. So we didn't want people standing outside waiting. A lot of patients come to us without an appointment. They have an urgent need. So we had this trailer, which was a place for them to go. We also partnered with Cape Cod Healthcare to establish a motel stay program for people who were either positive with COVID or had to be quarantined or socially isolated because of COVID. And that program made a huge difference. The second trend, or the second shift that we saw, was just an amazing, unbelievable increase in relapse and overdose among our population. Just yesterday, I heard statistics on the news that the number of people in the United States who died from overdose death last year is upwards of 87,000 people, which is 1/3, 30% higher than it had been just in the prior year. So we sprung into action with telehealth. So we did a lot of work over the phone. Our recovery support navigators, case managers were in constant communication with our patients who were very, very needy and needed a lot of support. And again, that work was also done with the support of the Cape Cod Foundation. So clearly we couldn't have done it without you. So I think I'll stop there. Really, the shift in the needs of people with mental health and substance use disorder, and then the huge increase in number of people that were unsheltered in our community.
Thanks, Heidi. And I think, your comments really underscore what we talked about at the very beginning, just about how housing is so connected to all of these other challenges in our community. And you really, you can't focus on one without focusing on the pieces, right? Jay, do you want to add, from CDP's perspective, just some of the adaptations that you've made as an organization related to housing and some of the things you've been doing?
Sure. So, this certainly required a lot of kind of policy and safety changes, like we needed to suspend non-emergency interior maintenance of our affordable housing units. And we started off initially with weekly wellness calls to all of our residents to check in with folks to make sure they were healthy, that they knew where to turn for help. To talk to them about what their financial picture was looking like, and started to lay the groundwork for them to be able to access rental assistance programs. I think though that, one of the takeaways for me is kind of as scary and overwhelming as a lot of this has been. Both of our community, in terms of the private sector and the public sector and all layers of government, though, really stepped up. We ended up only seeing about 15% of our residents needing to access rental assistance programs. That folks either stayed employed or the extra unemployment benefits were providing them with significant resources so that they were able to continue to meet their living expenses. And even though we were worried in September when those benefits were going to end, that somehow there was a cliff that was going to happen, it just didn't play out that way. HAC has been blessed to have gotten significant increases in the state rental assistance program and get people connected with those resources, and the benefit levels were expanded. We really haven't had to dip into private sources of rental assistance to the magnitude that we thought. And we, on the business side and helping businesses, we're also able to bring in $400,000 in a pool of $10,000 forgivable loans to low to moderate income owned small businesses. So there really have been a lot of resources made available for us to leverage.
Thank you. And Alisa, I know you guys, as Jay mentioned, have really ramped up the support, and you mentioned $2 million in rental assistance. So can you talk a little bit about what HAC's been doing?
Yeah, I mean, like my colleagues, we had to adapt really quickly and take a business that was face-to-face and required wet signatures literally to virtual in about 3 days. So we got 120 people working from home, and then tried to figure out how to ensure that we kept access to our programs and our services. So once we figured out, the internal workflow and mechanisms, we turned our attention to rental assistance, right? The thing about the Cape that's a little bit different than other housing markets is that our rental properties are owned by individual investors who probably own 3 to 5 units, right? So they don't have the carrying costs and the same kind of density in their portfolio to be able to handle any kind of delay in rental payment. It has a serious impact for the landlord, not only for the family who could potentially be homeless. So as we saw our housing market change, right, and the increase in demand for our housing, we knew that we had to work very quickly to shore up those landlords so they didn't decide to sell into this market. Right? Because like the Airbnb phenomenon, when you make it really easy for somebody to, make money on the housing inventory that we have, then that's what starts to happen. And we've seen a lot of investors come into the region of late and, picking up houses, going over asking price and multiple offers. So it's been it's put a lot of pressure on just regular working people living and trying to make ends meet here. So when we focused our attention on that kind of segment of our business, we knew that we had to be very deliberate and intentional in reaching every part of the region, every town, even the islands, and making sure that people had access to the new online application that we were able to create, where we didn't have to have the same requirement for the wet signature and face-to-face communication. We could do things over Zoom and electronically. So we reached out to over 50 other human service agencies and brought them in on how to use our application so that there was no wrong door, right? We didn't want people to be struggling to try to figure out how do they get this assistance. We wanted them to have just easy access, that they could fill out the application from their home or with a partner that they're working with, even at another agency. So we really turned our attention to making sure we had streamlined application process, and eviction diversion was really kind of the mantra of like, how do we ensure that both the landlord is whole as much as possible, and that the tenant can remain in place. And it was creating a system and working with the governor's office and the state to make sure that we had legal services and contacts into the courthouse, and working with other partners, like I said, that could give us the heads up on the crisis and things that were happening. So it shifted, it intensified and shifted our focus to really some of the things we'll keep doing, after COVID. We love the online application now. It's so much easier for everybody. And they don't have to come to the office, and you don't have to, travel. So there's some benefits that have come from it. But I think to Jay's point, like, because the government, the federal government and our governor really stepped up and saw where this could potentially go. They were extremely proactive and allowed the agencies like ours that have the regional contracts to become the administrator of these very proactive, aggressive, intentional programs. So it's been a good mix of private, public, and nonprofit innovation.
That's great to hear. I think, one of the themes that we've heard over and over again is sort of this forced loosening of restrictions, right? That in a lot of ways that I think all of us hope, want to continue moving forward. I think another big theme that we've heard, this is always important, but I feel especially right now, partnership and collaboration. So could each of you give an example of where this is really, a partnership you either established during the past year or that you already had has really made the difference in the work that you've been able to do with your clients? Jay, I'll start with you.
So sure, we had two existing partnerships, one longstanding and one in its infancy, that really blossomed over the last year. The first is the Homeless Prevention Council. So several years ago, we started contracting with the Homeless Prevention Council based in Orleans to provide wraparound resident support services for all of our residents. So that when a family missed a rent payment or was needing a referral to be connected and needed a case manager, there was no reason for us to replicate that kind of programming when there is a neighbor organization in our community doing that great work. And so we actually pay the Homeless Prevention Council to do that work for our residents. And that partnership just became very, very strong over the course of COVID. And so when we had through our wellness checks on all of our residents, we would just hand over that resident to homeless prevention. And one of the beauties of the work that they were doing too is not just helping with rental assistance, but looking at the whole financial picture. Does that family also qualify for fuel assistance, or can they get their mass health premium modified? Can they access SNAP programs so that you make sure that they could apply and deal with the paperwork to, particularly the folks who were paid on a 1099, and when the unemployment system was expanded, helping people navigate that bureaucracy. And then the second kind of partnership that also blossomed is, we had back in 2019 started convening a group of 6 nonprofits on the Lower Cape that serve low to moderate income individuals, and with support from the Cape Cod Foundation, started working together with the Community Development Partnership, Homeless Prevention Council, Family Pantry of Cape Cod, We Can, Cape Cod Children's Place, and Helping Our Women, and started to explore ways that we could coordinate and collaborate on services, share infrastructure, and then, since the other big thing that has been happening in our world over this last year is the great need to address racial inequality and strengthen our organization's capacity around diversity, equity, and inclusion. Our 6 organizations have been working together, brought in a Boston-based consulting firm to kind of coach and help all of us look at our governance, look at our employment practices, look at the way we provide services, the way we do outreach, to make our organizations more culturally competent and be able to address issues of equity.
Thank you. It's great. Alisa, how about HACC?
I definitely believe that, we're stronger together. Housing is it's extremely complicated and permeates every, piece of our life and our society. So, having those partnerships that are mutually beneficial in scope and, like-minded in approach, we can have a greater impact. As I mentioned earlier, in our rental assistance, for example, we have partnerships with South Coast Legal Services and the courts and, a bunch of human service agencies who have access to our application to walk their clients through. We've definitely worked closely with Heidi through this pandemic on the homeless outreach and her showering program, so trying to come to whatever problem is happening with a solution-focused mindset and being a good partner with resources that we can bring to avail. But if I were going to pick like one partnership that either I'm, the most proud of, or that was the most intentional for us this year, was looking beyond the programmatic partners that we do just as a course of business, and taking that 10,000 foot perspective and going back to, what are the root causes of housing instability in our region? And one of them is land use policy and zoning. So we intentionally created a partnership with the Association to Preserve Cape Cod, and together our two agencies are creating a mapping project of every town where we agree that land should be in conservation, and where we agree that there should be density for low to middle income housing development projects. And, it's been very interesting because normally our two agencies come from the opposite side of the table, right? We don't always agree. Even in our meetings, we don't always agree, but we do agree that each other's mission is important. And advancing energy, conservation and land conservation and reducing our carbon footprint and our environment is hugely important for us as human beings and for our economy. And Andrew agrees on the housing side, right? Like, we need housing in order to be able to sustain our year-round economy and our community. And so we both have, come to the table and worked very hard at creating something that we feel will be a good representation for both of our sides of the equation, and be able to use for our advocates. Our advocates will be able to use to advance our own missions, but also it makes us stronger together. It makes it a unified approach on housing, the environment, and these very critical issues that impact our region, specifically when everyone wants to go outside and it's a beautiful, beautiful Cape Cod, right? We've got to figure out how to preserve it. But with our seasonal economy, we need to have housing for our workforce.
Thank you. Yeah, I love that, the cross-sector, cross-silo collaboration, and that also gets a little into solutions. So we're going to come back to that. I want to give Heidi a chance to talk about partnership and what that's meant for Duffy. Oh, I think she froze.
Well, Heidi, they're great partners. Duffy is. I know she'll hopefully be able to jump back in here, but they're at the hub of so many important issues in our region that I hope she gets unfrozen.
Heidi's having some tech issues, so I'm going to give her a minute.
Yeah.
I mean, it wouldn't be a Zoom meeting without a tech issue, right?
Yeah, exactly. Yeah, but my dog hasn't barked yet, so that's.
Yeah. So let's go over to talk about solutions a little bit. So, we've talked about some of the short-term things that your organizations are doing, but what are some of the kind of longer-term solutions that are being discussed, within your organizations and your partners and in the community? And kind of second part of that is, how can people get involved? All the people on this call are obviously passionate about this issue and want to know how they can help. So what kinds of things are happening in the community that will, where people can get engaged? So two-part question. It's a long one. Jay, do you want to start with that?
So yeah, I think that fundamentally we need to build more housing, and we need to build housing that is different from the housing that we currently have on Cape Cod. 83% of the housing on the Cape is single family houses on 1 acre lots. That is not only the most expensive way to construct housing, but it is also the most expensive way for a municipality to service that kind of housing in terms of bringing utilities, water, dealing with wastewater, the number of roads and transportation issues. And so that if we had more diverse housing options, and and out on that lower Cape, it's even worse. It's 90% of our housing is single family housing on 1 acre lots. If we had more housing variety so that we had seniors who weren't overhoused because they have no place to go to be able to downsize out of a 4-bedroom house, when it's just 2 people living in it. If we had less expensive housing for young people or young small families, that would, I think, make a huge difference. And I think one of the solutions, one of the good news in all of this is, our communities have significant resources that can be put in play to leverage state and federal resources to create more housing. Just last year, the 4 Outer Cape towns collected an additional $3.9 million in local option short-term rental tax. Those are resources that are coming to the towns that can be used to help provide a steady funding stream to the housing trusts, and there's a possibility of using that revenue stream to go out and borrow. Now it is a really good time to be borrowing money to make long-term capital investments, and that will really positions our communities to not only be able to build more housing, but also build high quality housing that's green, that's got solar panels on it, and that reflects the character and the values of our community. And so one of the things we've been working hard to do, and I know Alisa and folks at HAC have also been advocating that we should be putting at least half of the short-term rental money that the towns are collecting into housing spending, so that we're then positioned to partner with the developer and leverage those significant resources that are available on the federal and state level.
That's great. Sorry, I couldn't unmute myself. Jay, can you also talk, before we switch over to Alisa and Heidi, a little bit about the housing partnership work and some of the citizen advocacy work that you've done?
Sure. So, the Cape Cod Foundation was the initial funder in an initiative that we launched about 4 years ago called the Community Housing Partnership. And one of the things that we observed was that our towns, staffed by well-meaning volunteers on committees and elected boards, really lacked the expertise and skills and experience to deal with the highly complex issue of building and financing housing. And so we launched a housing institute. We also started training advocates so that when public hearings came up, or there were town meeting votes, that we had people organized and positioned to speak in favor of housing. And then we also launched a media campaign last year and are just about to launch a second phase this spring entitled "We Can't Afford to Lose the People Who Can't Afford to Live Here," to really put a face in our community on who the people are, the EMT firefighter in Wellfleet, the health aide at Outer Cape Health Services, the teacher at Nauset Regional High School, that these are the people who are facing housing challenges and who are vital members of our year-round community and make our community work, and have really changed the face of what's going on in the discussion on the Lower Cape around housing. We now have every single Lower Cape town has at least one parcel in the development pipeline. Over the last 3 town meeting cycles, we have seen the 8 Lower Cape towns approve over $20 million in funding for a variety of local housing initiatives and pass over 40 zoning bylaw changes, ranging from ADUs and other zoning changes that make the permitting and building of housing easier. And this has really been an innovative project. A lot of communities across the state are looking at this as a model for helping to build the capacity of their own communities. And, and if, Kristin, you had wanted to talk a little bit too about what can the private sector do. This is a perfect example of the Cape Cod Foundation hearing about a project we were working on, stepping up and being one of the initial funders of it, and continuing to, I think, Kristin, we're now at $90,000 from the Cape Cod Foundation over the last 4 years to sustain this project and helping it grow and leverage other resources.
Thanks, Jay. And Alisa, I know HAC has been doing some similar work and, other perspectives on kind of long-term solutions and how people can get involved and engaged.
Yeah, we started with Jay on the Housing Institute and have continued it on the mid and upper Cape as well. The thing about housing and the way our government is here in New England is it requires participation. It requires us to get on the planning board, to go to town meeting, to understand what the issues are, and to make sure our voice is heard. And making sure that we understand the complexity of these issues and what the unintended consequences, as well as, the direct impact. And wastewater is one of those issues, right? A vote yes for wastewater infrastructure is a vote yes for housing and for our environment. It's using the same tax dollar for two very important issues. And so for us, town meetings coming up, right? Everybody here hopefully will understand what the issues are before them and be willing to make that investment in the wastewater infrastructure, any housing projects that are coming up, any zoning changes that really make it easier to build. Things with special permit or having to go to planning board, those are red flags for developers. Those are obstacles in the way of actually getting housing built. And so whatever we can do as a region or as towns to help clear the path so that we can get those smaller units built, we can get some, density, if you will, smaller projects in areas that are appropriate, not in where their land should be conserved, but where we do believe in the town center is the perfect place to be building that kind of housing. And so it's a community problem, right? And it requires all of us to really think differently about our homes, consider putting an accessory dwelling unit on the property or as part of the home, and think about land use differently. As Jay said, 1 acre, I have an acre lot here in Orleans. I don't need an acre. My house is on the front of the lot. I've got a big backyard that I got to mow, there could be a couple little houses back there. So it requires all of us to kind of shift our thinking, but without compromising the integrity of Cape Cod and the value that we all derive from the beauty and the conservation. But can we be more intentional and specific so that we are inviting to people who look differently or who make less money, to our year-round workforce, and ensure that we keep that vibrant year-round community and economy.
Those are great points. None of us really like change, right? And want to keep everything special and the same, but looking at this as a long-term challenge, if that happens, we're going to be in trouble as a community. And so there are ways that we can make changes and still maintain the uniqueness and all those things that are special about Cape Cod.
Well, Kristin, the Cape is changing. The Cape has been changing for years. So every meeting we go to, people say, we want to keep it the same. We want to keep it the same. It's not the same. Look back to Airbnb. It changed dramatically. It's changing again. The demographics and new homeowners that are moving here through COVID, it is changing. It's changing before our eyes. And the problem is we usually look in the rearview mirror and go, oh my God, it changed. Now what do we do? Where we have an opportunity to be proactive and intentional and say, hey, wait, what do we want to create? How do we want to make sure that this is a place that my children, I have 3 teenagers, where they can't live here. We've just put them through NASIT, right? Taxpayers paid for them to go from kindergarten through senior year. That's a couple $100,000 investment, and they can't afford to live here. Like that doesn't make that is a disconnect in our society of what we're investing in and what is important. let's make sure we're intentional to keep our people here who can invest and give back to the Cape.
Yeah, wonderful points. Thank you.
And Kristin, to
Yeah, we-
Alisa's point, the Cape Cod Commission did a market analysis 3 years ago and estimated that we need about 27,000 units of housing to be built to be able to make up for the units that we've lost, year-round housing that's been lost to seasonal housing, but also with some modest population growth. There's actually, under current zoning, room for 30,000 more houses. But under current zoning, that housing is going to be single-family houses on 1-acre lots. And so the question before us, as Alisa was just, is do we want to grab a hold of that change that's going to happen and control it and have it be high-density housing in village centers that can be sewered, that won't create traffic and sprawl and just turn Cape Cod into a suburb? That's the question before us. And if we, by making reforms to zoning and really changing the way that we develop now versus what we've been doing the last 40 years,
right,
we can keep things much more the same that they are. But if we sit back and do nothing, the market is just going to take over it and continue to build McMansions across Cape Cod.
Yeah. And thinking about like Chatham, right? Like the Chatham Village Center that everybody loves. You wouldn't be able to do that under current zoning. Right. So it's thinking about the places that we love and that bring visitors here and keep our economy going, and that we all as year-rounders want to go to. We can develop that so that there are multiple villages like that throughout the region and multiple destinations for people to come here and spend their money and still want to partake in all that Cape Cod has to offer. But we have to realize where we are, and we don't have the foundation, the structural foundation on our zoning, which is very dry and boring to try to understand, right? But it is the basis of how the towns are built. And without understanding that, we're going to just keep getting more of the same.
Great food for thought. Thank you. Heidi, do you want to add to the solutions?
Yeah, real quickly, and
Cities for engagement.
I apologize for my internet connection. I do just want to say quickly about collaborations that the county just really came to the fore throughout this whole pandemic, through the regional network on homelessness and the coordination that we were able to do through the regional network, and also the Regional Emergency Planning Council headed by Sean O'Brien and working with Vera Harik, all the work that they did to battle COVID. I want to take a little bit of we really wanted to focus on what Alisa and Jay had to say about housing solutions, but I want to focus a little bit differently on first step housing. We talked about these folks who are, their lives are shattered due to their life circumstances. And so how do we create the conditions or the circumstances so that people can pull their lives back together again? And it really is all about first step housing. So looking at, we have a number of partners in the community that provide first step or transitional housing, but there are sobriety requirements for those housing programs. And what we need is more of a harm reduction. With that, those places they're very important to the system. But really what we need to get people off the street is a harm reduction model for housing. So we're going to be promoting that, as well as another program that we're working to develop is medical respite, which is a place for people to recuperate from illness, too sick to be in the shelter, not sick enough to be at the hospital, a model called medical respite that we're going to be working on as part of our strategic plan. So those are the two things that I wanted to add to housing solutions.
Thanks, Heidi. Okay, so we've got about 10 minutes left. So I know we had some questions pop up in the chat. So I'm going to ask Dara for some assistance here. If you could read one of the questions, that'd be great.
Sure. This one seems timely. What are the implications of financial need once the rent and mortgage moratorium ends?
Wait, Dara, can you say it one more time?
Yes. What are the implications, like financial need implications, once the rent and mortgage moratorium ends?
Well, we know that there's about $57 billion of unpaid rent that's not for tenants who are not eligible for the federal and state programs. So the implication from a societal housing perspective is foreclosure and loss of units. And the implication for the residents is definitely homelessness. Will there be another bridge, loan or other kind of subsidy that comes in from the federal government or the state? Potentially, but right now, we're just kicking the can down the road on this problem, and until people are back full, childcare is back up and running fully, and people can be fully engaged in the workforce, and have programs that can help them catch up on their arrearages. Then we're just looking at a problem that's festering right now. It's unfortunate, but that's what's happening right now.
Jay or Heidi, anything to add to that?
I think Alisa has described a national problem that those billions are not Cape Cod, and I think clearly the situation is more acute when you get off the Cape, but there are definitely families who are struggling, and landlords who are struggling, and I think it's our hope that the existing programs are going to be able to meet those needs, and I think all indicators we are looking at a incredibly busy summer season on the Cape, particularly in the Lower Cape. And on the Lower Cape, a huge labor shortage, and our temporary seasonal workers are having trouble getting visas to come in. And so I think there's lots of opportunities for work. It's really, is childcare available? Can people, do people feel safe to return to work to get things back up and running again?
Thanks. Dara, is there another question?
Sure. Someone was asking about resources, specifically on the Upper Cape, but if somebody was looking for resources, where would we direct them? And we can follow up with links and all these questions and stuff as well afterwards.
Resources for rental assistance, I'm assuming, or just
services. Yeah.
So Housing Assistance Corporation, which is 508-771-5400 is our phone number. And then the website is hackoncapecod.org. And so you can start the application process there, or you can call the office and we can walk you through what services are available. I mean, if we don't do it, then we know who does, and we can connect people into those other resources.
Right. And I'm sure that the individual who asked the question is familiar with the major human services organizations in Falmouth. The Falmouth Human Services and the Falmouth Service Center are great places to plug in to identify resources.
I know there was a question that popped up about data. So one of the things that we'll include for all of the data lovers out there like myself, we'll send along some links to some really great resources. The panelists can correct me, but I think the challenge is so much has changed in the last year, getting that current sort of up-to-date data. So I know all of your organizations do a great job capturing, your clients and what you're doing internally, but there's always a lag with sort of the community data and what we're seeing. But we'll send along some links for that.
Kristin, too, I think it's important to note that the Regional Network on Homelessness has made data collection around homelessness one of our priorities for the coming year. So you're right, different agencies for different purposes cut and paste their data different ways. What we're looking to do is have a data set that we all feed into and that we can use to explain things to towns, explain things to community groups, to seek funding from the state and other resources. If we had good data that we could all hang our hats on around homelessness, that would be a huge step forward for us.
That is great to hear. Thank you. Dara, were there any other questions in the chat?
Some great ones about getting involved, and that I think you all sort of responded to, how do we advocate and push harder for, more affordable housing stock? I don't know if anyone wants to add anything to that, but I think you made some great suggestions, all of you already.
I think that both Alisa and Jay talked about the importance of private resources, and I wanted to add my 2 cents in that it really is so critical to have those dollars that are unrestricted that we can use, that we don't have to meet the necessarily rigid requirements that governments impose. So for example, with our shower program, we can charge the cost of the trailer, we can charge the cost of the security guard to help police the parking lot. Those things make sense, but we don't, if we need a pair of flip-flops or socks or underwear, we don't want to have to produce the receipts as part of a state audit for something like that. So just the small necessities and the things that people need are really, really important. And then also, I like to call it building a silk purse out of a sow's ear. There are so many ideas that we have that are just grains of ideas, and we just need a little bit of seed money, $2,000, $5,000, $10,000 to help us develop that idea into a proposal that we could then take to a government funder. Those kinds of investments on the part of the foundation and individual donors are so important to Duffy and to other human service agencies.
Thanks for mentioning that, Heidi. And that was one of the questions we didn't get to that we had planned to, was just, how to sort of use private philanthropy to supplement the state and federal funding. And I know for us as a funder, sometimes there's so many different opportunities out there. We're not sure exactly where we fit in, but being able to have those conversations with all of you and our partners to say, okay, you've got specific funding for this. What is the gap? How can we help fill that gap? So I would just encourage anyone who's looking, to support organizations to just ask, because we can't make assumptions that because they're state or federal funding that all your needs are taken care of, because a lot of times there are certain restrictions or needs that arise that you didn't anticipate, with that initial round of funding.
Kristin, you guys did such a good job this past year of reaching out to us and asking what are those gaps and what are those little expenditures that the contract isn't covering or that we're seeing and that we need. It was really very proactive and helpful.
I echo that too. The good news is we were able to access significant increases in federal and state resources, but also that was a layer of stress on our organization's infrastructure. And so to be able to receive funds from the foundation and other private sector sources, it enabled us to make great use of the additional federal and state funds and made sure that we had the capacity to effectively administer those increased resources.
Thank you.
Kristin, there are a couple trainings coming up. I believe they're on our website, but there's some housing training coming up through MHP and through CHAPA that we just sent out an email to our advocacy group on that we'd be willing to share with people on here if they're interested, but it helps to give kind of that foundational background so that when you're trying to understand the issue or make a decision, you've got the same knowledge, you're working from the same, knowledge base. So we could figure out a way to share that with this group if that would be helpful.
That would be wonderful. We can share that with all the follow-up information. So there's 1 minute left just before I do a quick wrap. Any final thoughts, or I'll ask you one quick silver lining from COVID, one positive thing to take forward from each of you.
I'll jump in that it's not my original phrase, but I've adopted it, and that is that COVID gave us self-confidence. Within Duffy, we feel that if we could do this, we can do anything. We're just so proud. I know all 3 organizations are just so proud of our staff and the way that they have heroically stepped forward, not thinking of their own needs first, but the needs of their clients and helping to get their clients settled and protected as much as we could from this terrible pandemic. So thanks so much to our staff.
Yeah, 100%.
Definitely echo that. This has transformed the way we are working. It has required us to embrace technology, and not just our staff, but our board leadership as well. And it's provided us the opportunity, as much as I am really tired of being on Zoom all day, but on a regular basis to be learning from our colleagues who are doing the kind of work that we're doing here on the Cape throughout the Commonwealth, and sharing ideas and brainstorming strategies. And all of that has made us much, much more effective.
Yeah, the fast pace of change, right? It's been very impressive and just really, I don't have another word. I'm just so impressed and grateful to my team and my colleagues for not just adapting for our current operations and really expanding the need and access, but also innovating. Like, we started new programs and started new funding, pools and just really were able to be creative in chaos, and create order out of it and march forward. And it's really been impressive to watch everybody step up and work from that place of the common good, like Heidi said, of, it's not just about us, but it's about making sure that we have our resources out to our clients in the community. So it's been very rewarding professionally.
Thank you. Good to end on a positive note. And so I want to thank all of you for being here today. Thank our esteemed panelists. Also want to thank our sponsor, PSD, for their support of the session. We hope you all found this informational and educational. We have a quick little 2-question poll that's going to pop up in a second. And we will be sending out all of the follow-up information, links to data, some information about trainings, and other ways to get involved and engaged. And we'll be capturing any of the questions that we didn't get to, and our panelists will respond to those. So you should see all of that in about a week or so. So if you have a second to take this poll, that would be great. And thank you all for joining today.
Thanks,
Thank you all.
Kristin. Thanks, Cape.
Thank you.
Do you want us to stay on, Kristin?
Dismissed.
Are we debriefing after? Okay.